In this narration, I'll be covering pharmacology related to the thyroid gland. So first, a little bit of patho review. Remember that our thyroid gland secretes T4, T3, and calcitonin. We've got a lot of intricacies involved between our the thyroid and the parathyroid, so they all kind of work together there, okay? Review your patho if you don't remember it. Graves' disease, thyroid storm, and then so that's the hyperthyroidism, and then when we move to hypothyroidism, that can be when it gets really severe, we call it myxedema, and it can be a myxedema coma. All right, so when we treat the thyroid gland, remember that if you have an overactive thyroid, you have to you have to deactivate it. Basically, we've got to kill it off, okay? And after that, you'll be underactive. And if you have an underactive thyroid, you got to replace stuff. So when we do treat hyperthyroidism, we can do surgery to remove all or just part of the thyroid gland. Remember that if we remove part of it, it's possible you might have some thyroid function still, but if we remove the whole thing, then you're not going to have any thyroid function. You will always need thyroid hormone replacement therapy. Okay, we can also use medications though. If we use medications, they basically kill off the thyroid gland. Okay, so methimazole, PTU, which is very highly tested, both of those, and then radioactive iodine, and then potassium iodide. All of those medications can be used sorry, I lost my train of thought for a minute. So all of those medications are used to treat hyperthyroidism, and they will prevent the thyroid and any goiter that could possibly be there from secreting thyroid hormone. Problem with these is that they can cause liver and bone marrow toxicity, which means we have to monitor liver function tests, and we have to monitor our blood count, so red blood cells, white blood cells, and platelets to make sure that they're not going down. Okay. All right, so this one, methimazole, otherwise known as Tapazole, I put the little cartoon there. When we are talking about this particular medication, along with the PTU, better taken with food, okay? And we tell people to take them at the same time every day because you want to maintain the proper blood levels of the medications to keep that thyroid in check, okay? You also can't ever stop them abruptly, and that is true of any hormone, basically, anything that affects your endocrine system. And then you do have to avoid eating foods that are high in iodine, which is basically your shellfish, soy sauce, because it's salty. Tofu is actually high in iodine, and iodized salt. So you have to have sea salt instead of your regular iodized salt. So the big blue container of salt, that you buy, if you've ever bought a thing of salt, rather than stealing it from a restaurant, that would be that's iodized salt. So you have to look for the non-iodized salt. All right, and then we have hypothyroidism treatment. So with this, we have to give supplemental thyroid hormone. Most common medication given is levothyroxine, and that is synthetic thyroid, or it's synthetic T4. Okay, and we actually will see people who are on some other kinds of thyroid hormones. If they're on something different, they've probably been on it for a really long time, and because they were stable, they just they never changed it. Okay, it's kind of weird to see somebody on something other than levothyroxine. Brand names of that are Synthroid and Levoxyl. It actually has two different brand names of the same medication. So basically, this is just your supplement, replaces what the thyroid gland cannot produce, and that is whether you have an underactive thyroid gland or you have treated your thyroid gland with something or maybe you've had it removed or something like that. We also use this medication to diagnose hyperthyroidism, and to see if it actually, if when we give you supplemental thyroid hormone, does your pituitary gland stop producing thyroid stimulating hormone, or TSH? So that's that negative feedback, and if you don't remember that from patho, go ahead and review it. Some people need more when they're pregnant, because sometimes if you're pregnant, you do actually have this hypothyroidism of pregnancy. And if you're already hypothyroid, then you have to still take it. This particular cartoon, I like this. Takes about 2 weeks to get totally into your system. Okay. We will usually wait for about 30 days before we can really, before we really know if you're on the right dose, okay? On this side of the ladder, if you've got too little, you're going to see all your symptoms of hypothyroidism. And if you've got too much, then you're going to see too much, or your symptoms of hyperthyroidism. Okay, so these 2 boxes here, this one's hypo, this one's hyper. If you miss a dose, 1 day is not going to kill you, okay? If you've missed a week, you're going to feel kind of sluggish. And if you've missed 2 weeks, you're going to feel like shit. Okay? So, because you're going to be hypothyroid again. All right, adverse effects. Cardiac dysrhythmias are the most significant adverse effect. So if you think about it, if you are hyperthyroid, then tachycardia is a very common symptom. And sometimes people are diagnosed with hyperthyroidism because they come in with tachycardia, including atrial fibrillation. We almost, anytime somebody comes in with hyperthyroidism, or with AFib, we always check their thyroid, because a lot of times people don't realize that they have an overactive thyroid. So all of this, these adverse effects here for your levothyroxine, those are all hyperthyroid symptoms, okay? So remember that we do want them to move along the spectrum more toward hyperthyroid. We want them to be euthyroid, which means normal, but we don't want to go this far, okay? So one little thing that something I've seen on HESI exams is that if your patient is bradycardic or slightly hypotensive and they haven't had their thyroid med yet that day, they might just need that rather than treating the bradycardia or the hypotension, because it's being caused by the low thyroid. All right, nursing implications. Cautious use advised for those with cardiac disease, hypertension, and that is because if you put them on too much, they're going to get hypertensive and tachycardic. When you are pregnant, you gotta watch it very carefully, okay? They have to continue to be treated, but we monitor their levels very closely, okay? If we do not treat it, fetal growth development will be suppressed, okay? We take our thyroid medicine first thing in the morning on an empty stomach. In a hospital, you'll probably never give it in clinical because it's time for usually 6 or 7 in the morning. Tell them to make sure that they report any symptoms of hyperthyroidism, and also if they have more symptoms of hypothyroidism. So they need to report both kinds. If they're hyper, they need a dose adjustment to go lower, and if they're hypo, they need an increase in dosage. Always make sure that they check about over-the-counter medications, specifically your decongestants, because they can cause tachycardia. And when you put that on top of the thyroid medication, then you could send somebody into, a dysrhythmia. And again, like I said, they take about, it's going to take 4 weeks before you can see, basically we tell people, give it a month. Let's see. Oh, so always make sure that they will, always make sure that they tell all of their providers that they're on it, okay? And then I already talked about monitoring for their therapeutic responses and adverse effects. So one of the things, anti-thyroid drugs, remember I talked about leukopenia? That's that bone marrow suppression, okay? So if you've got leukopenia, then they may come down, they may complain about a fever and a sore throat. And you got to watch that, check their white blood cell count. All right, review question. A patient who's taking a thyroid replacement medication tells the nurse she's starting to experience cold intolerance, depression, constipation, and dry skin. The nurse anticipates that these manifestations are caused by what? Pause. Answer this to yourself. And that would be A. She's got symptoms of hypothyroidism. She needs more med. So inadequate doses of the medication. Which information will the nurse include when teaching a patient about thyroid replacement therapy? Pause and answer this to yourself. And that is D. Take it on an empty stomach. We take it in the morning on an empty stomach. And remember that it's going to take a few weeks to kick in. Well, it'll kick in. They might see some effects after 1 week, but patient's been taking levothyroxine for 6 months. After this month's lab work, the nurse practitioner tells the nurse that the patient is euthyroid. What does that mean? I said it in the narration. That would be C. Thyroid hormone levels are within normal limits. And which would be the best menu choice for a patient who's taking an anti-thyroid medication? Remember, we want to avoid iodine. That would be D, pasta with marinara sauce. So seafood platter has, shellfish on it. Sushi usually is seafood, plus it's soy sauce. And a tofu burger, tofu has a lot of iodine in it. All right, this will be where the next narration picks up.